Gentlemen, if you're over 40 and notice your erections fading before or during intimacy, you are not alone, and there is a solution. What many men don't realize is that temporary loss of firmness is often a combination of lifestyle, blood flow, and subtle physiological factors. I'm Dr. Vera Sterling, a urologist specialist, and in this video, I'll reveal 8 simple and fast fixes to help you stay hard all the way through sex. These methods are practical, medically proven, and can restore confidence in your sexual performance without complicated treatments or embarrassment. Understanding erectile health and why erection loss happens. Erectile dysfunction, or intermittent loss of erection, is one of the most common concerns for men over 40. While occasional difficulties can occur for various reasons, consistent or repeated loss of firmness during intimacy signals that intervention may be necessary. Physiologically, an erection is a complex interaction of blood vessels, nerves, hormones, and psychological factors. Each element must function optimally to achieve and maintain rigidity sufficient for penetration. From a urological perspective, one of the leading causes of erectile difficulties is vascular health. Adequate blood flow to the penile tissues is essential. Conditions such as high blood pressure, atherosclerosis, and elevated cholesterol levels restrict blood circulation, reducing the ability to sustain an erection. Even subtle narrowing of penile arteries can result in the phenomenon many men experience, achieving an erection initially, only to see it diminish during intercourse. Hormonal factors also play a significant role. Testosterone, the primary male sex hormone, decreases gradually with age, affecting libido and penile responsiveness. Men with low testosterone may notice diminished firmness or difficulty maintaining an erection. Additionally, imbalances in other hormones, such as cortisol or thyroid hormones, can interfere with sexual function, making even previously reliable erections more fragile. Psychological components are equally critical. Stress, anxiety, performance pressure, and relationship tension can trigger the fight-or-flight response, releasing stress hormones like adrenaline. These hormones constrict blood vessels and impede smooth muscle relaxation in penile tissues, leading to partial or complete loss of erection. Men who experience occasional anxiety during intimacy may find that the problem becomes self-reinforcing. The fear of losing an erection increases the likelihood it will happen. Lifestyle factors exacerbate the issue. Smoking, which frequently manifest first as erectile challenges. Laboratory testing for testosterone, lipid profiles, and blood sugar can reveal contributing factors that may be corrected medically or nutritionally. In addition to understanding the underlying physiology, specific medical strategies can improve erectile performance quickly. Nitric oxide production, which allows smooth muscle relaxation and blood flow, is influenced by diet, exercise, and targeted supplementation. Simple dietary choices, such as foods rich in antioxidants, flavonoids, and L-arginine, promote vascular health and improve erections. Regular aerobic exercise enhances blood circulation and strengthens cardiovascular function, directly supporting penile rigidity. Another fast-acting factor is pre-intimacy preparation. Men who are well hydrated, relaxed, and mentally focused often experience stronger erections. Warm baths, gentle exercise, or engaging in non-sexual intimacy beforehand can reduce performance anxiety and prime the body for optimal blood flow. Small behavioral adjustments, such as avoiding alcohol or heavy meals immediately before sex, also make a measurable difference in maintaining firmness. From a urological perspective, medications or devices can be used when lifestyle changes alone are insufficient. Phosphodiesterase type 5 inhibitors, commonly prescribed for erectile dysfunction, act by enhancing blood flow to the penis and are effective in many men. Vacuum erection devices, penile rings, and other non-invasive tools provide mechanical support while minimizing systemic side effects. These interventions are most effective when combined with lifestyle and behavioral strategies. Finally, communication with your partner is often overlooked but essential. Men who discuss intimacy openly with their partners reduce performance pressure and anxiety. Emotional connection and reassurance during intimacy create a safe environment where both partners focus on pleasure rather than performance, indirectly enhancing erectile quality. By understanding the interplay of vascular, hormonal, psychological, and lifestyle factors, men can begin to address the root causes of erection loss. In Part 2, we will explore 8 specific, fast-acting fixes ranging from dietary adjustments and exercises to behavioral techniques and practical intimacy strategies that can help you stay hard and confident all the way through sex. 8. Simple and fast fixes to stay hard. During sex building on the foundational understanding of erectile health, the following 8 strategies are designed to help men maintain firmness and confidence during intimacy. Each method addresses specific physiological, psychological, or lifestyle factors that impact erection quality. Optimize blood flow with targeted exercise. Aerobic and resistance exercises are crucial for maintaining strong erections. Cardiovascular activity, such as brisk walking, jogging, or cycling, improves circulation, enhancing blood delivery to penile tissues. Kegel exercises, often associated with women, strengthen the pelvic floor muscles, which play a direct role in sustaining erections. Men who practice daily Kegels often report increased rigidity and longer-lasting performance. Even short, consistent sessions, 3 to 5 minutes twice daily, can have noticeable effects within weeks. Improved diet for vascular and hormonal health. Nutrition directly affects erectile quality. Foods rich in L-arginine, such as nuts, seeds, and lean meats, boost nitric oxide production, facilitating blood flow to the penis. Antioxidant-rich fruits like berries, dark chocolate, and leafy greens reduce oxidative stress, protecting vascular health. Omega-3 fatty acids, found in fatty fish or flaxseed, improve circulation and support hormonal balance. Avoid excessive alcohol, processed foods, and high-sugar meals before intimacy, as these impair blood flow and testosterone levels. Prioritize sleep and stress management. Quality sleep is essential for testosterone production and overall sexual function. Men who sleep less than 6 hours per night often experience lower libido and weaker erections. Stress management through meditation, deep breathing exercises, or even short mindfulness sessions can reduce cortisol levels, preventing stress-related vascular constriction that impedes erections. Maintain adequate hydration. Dehydration reduces blood volume and impairs circulation, which can weaken erections. Men should drink sufficient water throughout the day, aiming for at least 2 to 3 liters depending on activity levels. Hydration also supports overall energy, mood, and stamina, indirectly enhancing sexual performance. Use pre-intimacy warm-up techniques. Preparing the body before intercourse primes both physiological and psychological readiness. Gentle stretching, light cardio, or warm baths relax muscles and improve blood flow. Foreplay that includes touch, kissing, and non-penetrative stimulation increases arousal and readiness, reducing the likelihood of premature loss of erection. Integrating partner engagement into the warm-up creates anticipation and intimacy, improving performance and satisfaction. Integrate behavioral and mental techniques. Performance anxiety is a leading cause of intermittent erection loss. Cognitive behavioral strategies, such as focusing on the partner's pleasure rather than outcome, visualizing successful intimacy, or practicing controlled breathing during intercourse, can reduce anxiety. Men who consciously slow down and maintain rhythmic movements often find they can sustain erections longer. Mindfulness during intimacy, paying attention to sensations without judgment, reinforces confidence and prolongs performance. 7. Consider medical or supplement support. For men who continue to experience erection difficulties, despite lifestyle changes, medical interventions may be appropriate. Phosphodiesterase type 5 inhibitors, such as sildenafil or tadalafil, enhance blood flow to the penis and are safe when used as directed. Certain natural supplements, including L-citrulline or Panax ginseng, have also shown benefits in improving erectile rigidity in some men. Consultation with a urologist ensures safety, proper dosage, and identification of underlying health issues. Communication and intimacy with your partner. Open communication is often underestimated in its effect on erectile quality. Discussing preferences, comfort, and sexual pacing reduces performance pressure. Couples who incorporate touch, eye contact, and gentle guidance into intercourse create a supportive environment, enhancing arousal for both partners. Emotional intimacy and reassurance can prevent anxiety-driven erection loss, making sustained rigidity more achievable. Integrating these strategies into daily life. The most effective approach combines several of these strategies simultaneously. For instance, a routine that includes daily exercise, proper diet, stress reduction, and pre-intimacy preparation creates a strong foundation for sexual performance. Men should also monitor their results, noting which adjustments yield the most significant improvement. Small, consistent changes often produce faster and more sustainable outcomes than occasional interventions. From a urologist's perspective, understanding the interplay of physiology, psychology, and lifestyle is critical. The penile tissues respond not only to direct stimulation, but also to overall health. Cardiovascular wellness, hormonal balance, muscle tone, and stress management all converge to determine erection quality. Men who address these factors proactively maintain not only sexual performance, but overall vitality and confidence. It is equally important to recognize that occasional loss of erection is normal, and men should avoid self-criticism. Creating a non-judgmental environment, combined with practical strategies, encourages consistent improvement. For men over 40, adopting these 8 fixes is about regaining control, improving confidence, and restoring intimacy in a meaningful way. Finally, men should consider periodic medical evaluations. Conditions such as hypertension, diabetes, or early cardiovascular disease often manifest first as erectile difficulties. By consulting a urologist, men can receive tailored advice, lab testing, and interventions that address the root cause, ensuring that their sexual health is supported alongside overall well-being. By implementing these 8 simple and fast fixes, targeted exercise, optimized diet, stress management, hydration, pre-intimacy preparation, behavioral techniques, medical support, and partner communication, men can significantly reduce the likelihood of losing an erection during sex. Consistency, patience, and awareness create lasting improvements, allowing men to stay hard, satisfy their partner, and regain confidence in their sexual performance.